Bismillah ar-Rahman ar-Rahim. In this lecture, I will talk about goiter. A goiter is the irregular growth of the thyroid gland. A goiter may be an overall enlargement of the thyroid gland, or it may be the result of irregular cell growth that forms one or more lumps or nodules in the thyroid gland. A goiter may be associated with change in thyroid function or with an increase or decrease in thyroid hormones. Goiter is relatively common. They are prevalent in about 5% of people in USA. Goiter is typically not dangerous unless the underlying cause of thyroid enlargement is a thyroid cancer. The case here is papillary thyroid carcinoma. It is important to identify the cause of the goiter to rule out cancer. Worldwide, over 90% of goiter are caused by iodine deficiency. Case here is goiter caused by iodine deficiency. Now, symptoms and signs of goiter. Most people of goiter have no signs or symptoms other than a swelling at the base of the neck. In many cases, the goiter is small enough that it's only discovered during a routine medical exam or an imaging test for another condition. Other signs or symptoms of goiter depend on whether thyroid function changes, how quickly the goiter grows, and whether it obstructs breathing. Here we are seeing goiter with obstructs breathing. Here, goiter with hypothyroidism, and here, goiter with hyperthyroidism. We have three cases of goiter. The first one is goiter with hypothyroidism. The second case is goiter with hyperthyroidism. The third case is goiter with enlargement thyroid gland. The first one is underactive thyroid gland or hypothyroidism. Symptoms and signs in this case include fatigue, increased sensitivity to cold, dry skin, constipation, muscle weakness, problems with memory or concentration. The second case of goiter is goiter with overactive thyroid or hyperthyroidism. Symptoms and signs in this case include weight loss, rapid heartbeats or tachycardia, increased sensitivity to heat, excess sweating, tremors, irritability and nervousness, muscle weakness. This case of Graves' disease with hyperthyroidism. This case is goiter with hyperthyroidism. In the same case of goiter with hyperthyroidism, symptoms include frequent bowel movements, change in menstrual patterns, sleep difficulty, high blood pressure, increased appetite. The third case of goiter is goiter with normal function of the thyroid gland or obstructive goiter. The size or position of a goiter may obstruct the airway and voice box. Symptoms and signs in this case include difficulty swallowing, difficulty breathing with exertion, cough, and hoarseness, snoring, stridor. Now, causes of goiter: iodine deficiency. Over 90% of goiter cases are caused by iodine deficiency. Hashimoto's disease or Hashimoto's thyroiditis. It is an autoimmune disorder that can cause hypothyroidism. Graves' disease. It is an autoimmune disorder that can cause hyperthyroidism. Thyroid nodules. They are solid or fluid-filled lumps that form within the thyroid gland. Thyroid cancer. It is a disease in which malignant or cancer cells form in the tissue of the thyroid gland and cause goiter. A pregnancy. A hormone produced during pregnancy, HCG hormone or human chorionic gonadotropin hormone, may cause the thyroid gland to be overactive and enlarge slightly. Inflammation or thyroiditis. It is swelling of the thyroid gland. Now, complications of goiter. A goiter itself does not cause complications. The appearance may be tribalism or embarrassing for some people. A large goiter may obstruct the airway and voice box. Changes in the production of thyroid hormones that may be associated with goiters have the potential for causing complications in multiple body systems. Now, diagnosis of goiter. We will begin with physical examination and blood tests, levels of FT3, FT4, TSH in the blood, ultrasound of the thyroid gland, CT scan of the thyroid gland. We are seeing here goiter, biopsy of the thyroid gland or FNA cytology with goiter, or fine needle aspiration cytology of the thyroid gland. Now, treatment of goiter. The doctor will decide on a course of treatment based on the size and condition of goiter and symptoms associated with it. Treatment is also based on health problems that contribute the goiter. Medications of goiter. If the patient have hypothyroidism, we will give him erythroxine. If the patient have goiter with hyperthyroidism, we will give him tabazole. Medications to treat this condition may be enough to shrink a goiter. Surgeries, thyroidectomy, or removal of the thyroid gland. Thyroidectomy is an option if yours grows too large or does not respond to medication therapy. Radioactive iodine in people with toxic multinodular goiter, we will give him radioactive iodine may be necessary for these cases. In the end of this lecture, thank you for all.